Work on a $7 million expansion to the PEI Cancer Treatment Center is now finished. Officials were on hand today to applaud the addition. The center was enlarged to make room for a second linear accelerator. Those machines deliver radiation treatment to patients with cancer at the Queen Elizabeth Hospital. The expansion should reduce wait times. Joining me now is Dawn McIsaac, and she is the acting manager of the PEI Cancer Treatment Center here at the Queen Elizabeth Hospital. Now, Dawn, how many people work here at the Cancer Treatment Center right now?
We have approximately 60 staff members, and that includes everywhere from secretaries to physicists to radiation therapists to nurses to oncologists, to a multidisciplinary support team, which consists of our spiritual care worker, dietitian, social worker. We also have a nurse practitioner, which is really a benefit to have to the center as well too.
And how many patients do you treat every year?
We treat approximately about 900 patients per year in the whole center.
Wow, yeah. 900 patients.
Yeah.
So tell me we're here in this room with something called a linear accelerator. Is this the main part of your new expansion here at the QEH?
It is. This is the expansion. This is the kind of what we had to build a bunker to put this in, so that was the biggest part of the infrastructure. We also then we have resources that come with putting another machine in, so that's resources and staffing, so we ended up having to build office space as well too. But the main part of it is this bunker to house the linear accelerator.
Why is an expansion of the Cancer Treatment Center needed?
The expansion is really mostly needed for upgrading our equipment. Our linear accelerator we currently have, we've had it for a few years. The biggest thing is that we've only had one, and to meet standards, most facilities have 2 linear accelerators. Should one go down, then you're not interrupting that patient's treatment plan. So it is a safety factor to have the second linear accelerator. And ours was, it is getting on in its years. It's still a reliable piece of equipment in that, but with anything, you need to be planning for the future.
What does a linear accelerator do?
A linear accelerator delivers a radiation treatment to patients that have cancer mainly, but they're sometimes for pain management as well too, but the majority, what we do here is for treatment of cancer patients and tumors and that.
Are there more doctors and nurses then attached to another linear accelerator?
Nursing-wise, we had upgraded our nursing staff in last year. What really required us is more radiation therapists, who are the actual therapists are the ones that actually deliver the treatment. The radiation oncologist, we do have one radiation oncologist now, and there is another one currently that is supposed to be coming in February. So we'll end up having 2 radiation oncologists. Yeah.
What does this mean to Islanders, this expansion here?
This expansion means that Islanders have the security to know that we have a machine we'll always have a machine working. Chances of 2 machines ever going down are really quite slim. It also means that we have an upgraded model. It allows us to do new technology as technology is advancing. It will allow us to have more precise imaging treatment. And that's biggest. The biggest thing is the comfort of knowing that you won't lose that treatment time if one of the machines goes down.
Has that happened?
It's never really happened. We have had times where one of the machines might have been down for a half a day, or I'm not even sure if it's been down for a day or not, but there has been times where we've had to delay, and then we work later into the evening, or we reschedule the patient and they get a catch-up at some other point in time. So, yeah.
Dawn McIsaac, thanks so much.
Thank you.